they are.
Yeah.
No, I'm on the TV now. Not on the monitors. Yeah, I told you. Okay. Ascension Parish Mental Health Board is called to order, and the minutes of last month's meeting cannot be approved tonight because two of them have not received their packages yet, and we have one absentee who is Jerry, and we're expecting him to show up any minute, hopefully. Any two-thirds?
No two-thirds.
No two-thirds. Public comment. No one wishing to speak on any agenda item? 5 is our needs assessment, and Ms. Renda, I'm going to let you introduce them and tell us a little bit what we're expecting.
Okay, thank you. We asked Lorinda Colon and Dr. Pam McMahon from Robert Rose Consulting to put together a proposal for a needs assessment for the substance abuse and mental health services in Ascension Parish. And so they're here tonight to talk to us about what they would propose we do to come up with a needs assessment for the parish. Lorinda?
Thank you so much for the honor of presenting to you today. I've included just a few slides for an overview of what our proposal actually entails instead of making you read the whole entire proposal this evening. I'm Lorinda Colon, and I'm with Robert Rose Consulting, and just a little bit of background about Robert Rose might be beneficial for you. In the year 1999, I was appointed by President Bush to serve on a council that oversaw the supply and demand of physicians in our country. And in that tenure, I realized that the state of Louisiana was leaving a lot of money on the table. We didn't understand funding. We didn't understand how to access decision makers. So when I finished my term with the White House, I came back to Louisiana and started a grant writing firm. And to date, we have brought in $48 million to the state of Louisiana. We're very proud of that. We've also really branched out, and Brenda knows me from my social work days, and I also have a master's in education. My love is community development and community assessment, and I grew up the granddaughter of a sheriff in Vermilion Parish, so I understand politics and small communities and the fact that you just sometimes have to go door to door to really hear and listen to what people have to say and what their needs are. So I want to put that in context of my proposal today, because I do believe in going where the client is or where the patient is. What we've decided to do is put a proposal together that is inclusive of the community. In doing a needs assessment, we understand there have been needs assessments done in the past here in Ascension Parish. But what we would like to do is have that be a collaborative approach, inclusive of the board this time, and inclusive of the executive director of the center, as well as the community and potential stakeholders. One of the things that came up in discussions with Renda, a couple of the board members, as well as the executive directors, we don't have an understanding of how or what people know of these services. There was a survey done, it looks like a year and a half ago, that 70% of the respondents didn't know the entirety of the services offered by this center. So our next question is, why? Why don't they know that, and what can we do to educate the public about this vital service in Ascension Parish? What we propose to you tonight is a 3-step approach. We would like to come in and start off with a strategic planning session. This would be a brainstorming session where the board would be included, the executive director, and my team from Robert Rose. And we're going to come up with your perceived needs, what you're hearing from your constituents and the people that you represent. Then we're going to focus on identifying those stakeholders groups we need to meet with. I have found it very beneficial to partner with churches and pastors in the area. You would be very surprised the information you get from some of your key community leaders, and a couple of the board members have already given me a list of potential community leaders that we can go to and ask for what are the best areas to hold focus groups. We also talked about really trying to identify schools about to be out, and that's my only concern about going into the schools, but some way to tap into teachers. Other important groups like that would also be essential. We're then going to look at previous assessments and surveys done. We don't want to replicate or duplicate anything that's been done already. So we're going to analyze that. We're also, we have a really good database from the state mental health center, the Office of Addictive Services for the state of Louisiana. We're going to pull all that together. So not only are we going to take what the community tells us the needs are, we're going to look at what the data substantiates. This will also give the board the data you will need to maybe apply for grants in the future, or maybe additional funding that can help some of these efforts as you proceed. And then we're going to come back to the table with you, tell you what we've had, what the data shows, what the community tells us, and then we're going to start formalizing our recommendations for you. I think the difference in what we do as compared to maybe other consultants is we don't just leave you to take our survey and assessment and figure out what you're going to do, because I think if there has been a disservice in the past, that may be where the line was kind of dropped. It's here's the data, thank you board, and the consultant said bye. What we want to do is be involved with you as you start your plan of action. What does this community truly need? What do those programs look like? What are some best practices? Where does the evidence show people really benefit from programs the most? We'll work with the executive director, we'll work with the board, and more importantly, we'll work with the community. And I will tell you the story of a superintendent I work with from Macomb, Mississippi. This superintendent was from Louisiana, just great thinking guy. He goes into Macomb, one of the worst school districts in the United States. Highest level of poverty, highest level of absenteeism in the United States. And he goes into that community, and the superintendent before him had paid an enormous amount of money for a consultant who came in and said, this is how you go about changing this school system. And this guy's approach was different. He said, this is a community school system, this is the public school system, let's leave it up to the public to tell us what they want out of their school system. And he had community focus groups and community forums. And today, he's one of the top ranked public school systems in the country. And so that's a lot of our approach. What does the community of Ascension Parish want in the way of mental health services? What does that look like for the people who are recipients of the taxpayers' dollars? In our formal recommendation, we're going to have a plan of action. You will be advised every step of the way. There will be no surprises, and we will not leave you with the packet that says, okay, thanks, and call us if you need. We'll be here with you, we'll help you with the plan, and we'll see it to fruition. And Brenda said keep it short and sweet, and so hopefully I adhere to that. Are there any questions?
Well, I really like the approach you're coming with, and that's what we really need, is someone to stick with us and help us get to. And my idea of what we want is preventing us from having to have patients and other things occurring, like in the school systems and the shootings and things. If we can prevent this way down the line, that's my dream. And I appreciate you, and I think we're headed that way. Brenda?
Yeah, I would just like to say I think that's exactly what we were looking for. That type of approach I think would work very well here. I especially like the fact that you would not just come in and then hand us a needs assessment with recommendations and say, good luck implementing it, because I think that is where things fail. And I think, just like you said, Ms. Italia, that a portion of our responsibility should go to primary prevention as well as to treatment services. So I'm very interested in pursuing this further. And I assume you have more information about the cost and your terms in
Absolutely.
here?
In the proposal, which is in the back part of your packet, we actually break it down into what our goals and objectives would be, what we hope to accomplish every step of the way, and then I think we included the project cost on the last page. Dr. Pam McMahon is with me tonight, but we also have Tara Haney, who is back at the office, and we also have Martha LeBlanc, who's a researcher who can analyze data. She puts me to shame. You know, she's one of those people who you hated in class because they can look at a number and tell you exactly what it means. So we have a team of 4 of us who would be working on this project, and my estimated costs were $24,000. Typically, what I like to do is up front, because I do have to pay the team to work with us, and then you don't pay us until you're satisfied at the back end the rest of the cost.
Okay. And you may have it in here. I just haven't had a chance to spot it yet. But what would be the timeline? What do you anticipate we'd be looking at in terms of time?
Our work period is looking like 4 to 6 weeks. I'm going to need advisement from the board whether you want that to be during the summer or if we want to wait to the beginning of the school year. It depends on when you approve and tell us to get started. But our timeline, our work plan, is 4 to 6 weeks.
Okay, and that is from the first meeting with the board until we're talking about recommendations and a plan to implement those recommendations.
Well, why would school be that important, or whether they're in school or out of school?
It depends on the strategic planning meeting, and if direction from the board. If you say we really think we have an issue with adolescent substance abuse, what about engaging some of the teenagers? You do have some data on that from a previous consultant.
Right, we have.
Yeah, and I would be very comfortable, but if the board made that a priority, I would be advised by the board. I think we can do it this summer, but again, that's up to
Do we
you to
want
make
to
a
discuss
decision.
this, whether we want to start it? I thought we were interested in getting it done as soon as possible. And
Summer might be better because you got access to families and stuff.
And that's what I said.
Well, we're at the mid-April, almost the end of April, so if we looked at, what is your timeline? If we said, once we give approval,
The earliest we can start is June 15th.
June 15th.
Because we have several projects we're wrapping up. So we can start effective June 15th.
Okay. So we would be in a position to begin implementing by the time
By
school
school.
ramped up in the fall.
I would like to thank you for your approach, and I just use this little phrase to wrap it all up, and also prevention is way worth more than a pound of cure, so I appreciate your approach, your tactics, and we're looking forward to working with you.
Thank you very much.
Okay.
No, I don't.
Well, do we want to meet and discuss this, or do we want to make a motion to go ahead and hire her to start on that date? Because as far as the $24,000, I really don't find that is.
No, considering what a
We're
true
hoping for.
comprehensive needs assessment does for us as an agency, as a board, I do think that is in line and is reasonable. You're talking about a team of 4 people working. You're talking about an approach that would put the board and the administration on the same page, a strategic plan that could take us through years of service. So I also think that it's reasonable, and it would be a very good investment.
If we want to take it home and look over it and come back next month, what's next month? I'm sorry, yes, ma'am.
I just wanted to let you know that we still need to send, their contract through our legal department, which may take a few weeks. So I think if y'all could go ahead and make a motion, maybe a motion pending approvals, and then, funds being appropriated and those sort of things.
And that would give
I
us
think-
a month to read over this and to ask
Right,
a few more
right.
questions and things
Just,
like that. So,
if you're going to go ahead and make the motion, just pending the approvals.
Okay, that's fine. Then I'll make a motion that we accept the proposal pending the approval of the
Legal and Finance Department.
Legal and Finance Department. Thank you.
Second.
you take a vote. Mr. Lambert?
Yes.
Ms. Lynn? Yes. It passes unanimously.
Thank you very much, and we look forward to getting to work.
Thank you. Okay, we have our status report from Mr. Ryan by the state.
Good evening.
Good evening.
How y'all doing tonight?
We're good, and you?
Good. I'm doing fine. Thank you. First of all, I passed out the statistics, so if you have any questions about those, I'll be glad to answer them right now. If not, I have just a few things that I would like to discuss. First of all, we ended up having our meeting with the West Ascension Ministerial Alliance on April the 2nd. We met with Reverend Williams and I believe 4 other ministers from the Donaldsonville area. It was myself and Charlene Gilliard, who is a prevention specialist from Capital Area, and so we gave, I would say, about a 15 to 20 minute presentation on our referral process to the Donaldsonville services and ways to address prevention in the churches. And I believe that Charlene even set up a meeting with one of the ministers to give a presentation to, I think, about 50 adolescent children in Donaldsonville. So she had set that up, and I think that is either has happened or will be happening in the near future. Do you have any questions about that meeting? Okay. 2 other things that I think the board would benefit from knowing is that Capital Area is setting up a behavioral health emergency collaborative. We are working with a number of agencies in the Baton Rouge area, as Our Lady of the Lake, Baton Rouge Police, Baton Rouge General, and many other mental health agencies in the area to set up a crisis intervention team, which is training for the police officers in the Baton Rouge area on how to deal with mental health clients that they come in contact with in the community. So they're setting up a curriculum and they're setting up a training model so that we can go through that with the police department and a number. They're trying to get some LSU professors on board in the training. So I believe that the Ascension Parish Sheriff's Department was invited to be a part of the collaborative, as well as St. Elizabeth Hospital. I'm not sure if they have representation there, but I know that they were invited to come to that as well. And the other thing that we're working on, which is in the planning stage, is a crisis intervention unit, which would be a place where emergencies from maybe hospital room, emergency rooms, or from mental health centers could be transported to this unit where they would be evaluated and assessed and determined if they need hospitalization or if they just need respite or monitoring for an amount of time. They're focusing right now on East Baton Rouge Parish, but that would be something that we could utilize as well here in Ascension. Do you have any questions about any of those, the collaborative or?
I don't have a question about those, but I do have one other question for you.
Mm-hmm.
Are you familiar with the initiative that Capital Area has on the screening of pregnant women for substance abuse? And
the fetal alcohol. Yes. I don't know a lot about that, but I know that that's something that they're doing with the cooperation of the hospitals.
Yes. One of the questions I have is whether or not the data is being broken down by parish within Capital Area, because many of the women from Ascension Parish who are seen by Baton Rouge physicians throughout their pregnancy actually live in Ascension Parish. And so my understanding at the last meeting that I attended about that initiative is that they were all grouped together.
I think so.
And there was one report out. And I wonder if we could not discuss the possibility of breaking out by zip code, perhaps, the women, so we can get a better picture of the number of women
in Ascension Parish.
Yes, in Ascension Parish who need some intervention services. Well, the program's fabulous, and I think it has really wonderful potential for prevention and education. And Dr. Chasnoff has the most widely recognized authority in that whole fetal alcohol
I
area.
believe that they're intending on expanding the initiative. They had started with just a few hospitals in Baton Rouge, and they're expanding to the outside areas. I can discuss that with Jan and give her your recommendation that maybe they could break it up by parish so that we would know exactly how many people it's involving with Ascension Parish women. I know, well, most of the women from here have to go to deliver babies and
Right.
things in Baton Rouge. So,
Right.
So I would have, I think that it would affect a lot of women.
Yeah, and my
in
understanding
Ascension
is they're
Parish.
screening for alcohol, drugs, domestic violence, and mental health, depression.
Yes, that's
Especially
correct.
depression. So,
That's correct.
and I realize it's self-report,
Right.
but my understanding is that they have identified a number of women and have been able to do that brief intervention with these women and make referrals when the problem's more serious. So I think it's a wonderful opportunity for us to collect data about the women in Ascension Parish. So if you could ask her about that. I'd
Sure.
appreciate
The
it.
other thing is, if you'd like, I could ask and see if the person in charge of that program might be able to come and speak to the board.
Yeah,
If that would be
Vivian
something-
Geddes.
Mhm. If that would be something you'd be interested in, I can definitely get in touch with her and see if she would be interested in doing that. Would you like that?
Appreciate it.
Okay, sure. Any other questions? All right. Well, thank you.
Thank you.
Thank you.
Okay, Ms. Susan, the Ascension Parish Mental Health Director.
Thank you. I'm sorry some of you didn't get your materials. We mailed them out a week ago Friday. What do you think would be a good timeline for mailing them out?
So I really have no idea what happens because
Okay.
mine is dated the 13th. It was postmarked the 13th, but I did not get it till this afternoon at 2:30, so it was impossible to go through it all. And I don't have any suggestions.
Maybe it was tax day. Tax day.
That actually may be. That may
Now,
be.
once before, this same thing happened. Mine came, and I brought it to prove that it was mailed when she said it was mailed.
Yeah.
So there's nothing we can do about
It
it.
should be.
The problem that we have with mailing them too early is that we don't have all of the data for the report. And if you want all of the data on the report, then we have to wait a little bit longer. So I used to mail it out 2 weeks in advance, but then you got half a report and had to get the rest of it. Okay, so it goes out in the new mail on Friday.
on tax this time, okay? Thank you.
If you look at your Ascension Counseling Service statistics, I wanted to call your attention to one item. The total from therapist helper underneath the first set of tables says that we provided 757 services in March. And then the total on the chart says 943.
Yeah.
Our therapist helper only counts those services that are billed, that we collect money for, and so the 747 does not include the nurses' services or the services provided by our school counselor. We don't charge for those. So we actually did provide 943, but some of them didn't go through the therapist helper. So
943 patients.
that's actual no, it's not 943 patients, it's 943 services. So one patient may get 4 services in a month.
Oh, 4 appointments in a month.
May get 1.
Yeah. Okay.
So
Understand.
we've been counting services. We could count individual appointments, couldn't we, Celeste? I mean, individual, if you'd like a rate of how many individuals got a service in the month, we can do that too if you'd like.
No, I was trying to figure out, like, some people need to see a psychiatrist or a counselor or a profession more than once a month, because some...
Well, we try to schedule them based on their clinical needs.
Exactly. And that's what this is based
Right.
on, the clinical needs.
Under personnel, we had 2 counselors who resigned in April, effective the 26th and the 27th of April. We have been interviewing for those positions, and I included in tonight's material a table that looks like this, that I know you don't have time to look at, but it has a list of everybody we received an application, resume from, and a cover letter. And I left the names off since we're not allowed to give names, so I just numbered them for you. What we did was interview so far 3 people, but 2 really stood out, and we'd like to offer them jobs, one for the mental health position, one for the substance abuse prevention position. And we'd like to fill those positions as quickly as possible, because when the position is open, people either have to wait until we bring somebody on, or, well, they have to wait, plus the other counselors have to add to their caseload. It's very difficult for them because they're all very full. So we've identified a mental health counselor who's a social worker and has excellent credentials, who can start next week. And then the substance abuse counselor can start May 7th, if pending your permission to offer them a job.
And you're not going to tell us the names of these 2 people that we're...
I can tell you privately.
Huh?
I can tell you privately, but personnel regulations don't allow us to.
May I ask why are they resigning?
Personnel, but why they're
resigning?
One of them, well, actually, I don't think I can tell you that. I'm sorry.
Well, I just never before, and when the parish president hires somebody, they give them the list of the names.
I'll be glad to talk to you after we're off the air. I'll give you all the information you'd like.
Fine.
If we could do that.
Can I just ask you,
Sure.
are any of them residents of Ascension?
Yes. One of them is a resident. It's very important to me to hire Ascension residents because they don't have a long commute.
Right.
And they're happier in their positions if they don't have a long commute. The mental health counselor is an Ascension resident. The substance abuse counselor lives on Highway 30 right at the Parish line, right in that area. She's on the other side of the Parish line, but she's close. So I was really pleased about that. Gas is just really expensive, and it's difficult for our salary to cover lots of gas. So what would you like me to do?
Well, I want to discuss
Afterwards?
my name, I guess.
Okay. I'll be glad to talk to you afterwards, and I'll be glad to go over the list with you afterwards and explain the strengths and weaknesses of each application. Another item that's not on your material that I'm presenting for the first time for you to consider, and we'll talk about more next time, is that I would like to upgrade the clinical manager's position to assistant director / clinical manager, and I'd like to give her a raise for that position. She is currently in what's called her salary slot is 121. I'd like to raise her to the next salary level, which is 122, and that each salary level has a maximum, and the maximum for her current salary level is too low. She's 2 years overdue for a raise, and so I've included a job description for you to look at and a rationale, and then we can talk some more about it next time.
So she doesn't see any patients?
I've asked her not to. She will for emergencies. She had a caseload when I came, but she supervises everybody else, and she really can't I can't have her time tied up that way. So she does all the supervision.
What constitutes supervision?
An hour.
I mean, each one of them do their own paperwork and their own...
No, they're very closely supervised.
A principal supervises the school, but he does not control the...
Right.
I mean, I'm not understanding what her job is if she does not see any patients. And your counsel...
I'd like you to read the job description and bring me any questions that you have next meeting, and I'd be glad to. I'm glad to go through it now, but if you read the job description, I think it'll answer your questions.
Well, job description I understand, but I do not understand why a counselor needs that kind of supervision.
Each
See, the
client
director
that we
used
see...
to supervise.
May I make a suggestion?
Yes, ma'am.
Let us talk about this in between this meeting and the next meeting.
I think that'd be a good
please.
idea. Okay.
Thank
Can
you.
I ask for one other thing, and we may have it in the book that you gave us, but can we get a copy of the job description for the director?
You have that, but I'll be glad to give it to you again.
Okay.
Sure.
It would be in our policies and procedures?
It is. Uh-huh.
Okay.
Yes.
Okay.
It's
And that-
in there already, though.
Okay, and is this new for the assistant director? That is a completely new
It's a completely
position?
new position, and it would be combining two positions.
Okay.
It'd be-
Well, then if we could have the others that we could look at and...
You have all the positions that we currently have at the clinic should be in the, you don't
Policies
have
and
that?
procedures.
It was at one version of it, but we'll send you to that. We'll send you that.
Okay.
Okay. Right. And that'll help you to see what people do. Under grants, we finished 3 grants this month. It's been a really busy month. Governor Safe and Drug Free, the Capital Area Treatment, and Capital Area Prevention are all completed, and I'm delivering them tomorrow. So we got Governor Safe and Drug Free in a week early, so I was really pleased that we didn't have to wait right up until the last minute.
Susan, while we're on grants, can I ask you
Sure.
something about grants? Are you aware of any of the grants that OID is offering to community agencies?
Yeah, I watch them from time to time.
Okay. My understanding is that they are in the process of rolling out, have started some, and then there will be more coming out, but up to
Right.
$20 million worth of grants. And at a conference I attended a week or two ago where they presented, they talked about specific grants for community agencies. So that might be something to...
They had a grant earlier that I was just dying to have, but they had extra money, and they put out an RFP, and the program had to start March 1st and end June 30th. And we can't do anything that fast. We can't even write a grant that fast. So it was really for people who were ongoing grantees to have some extra money for whatever program they already had. But yes, I'm interested in some of their things.
And what it sounded to me like was that because they were trying to put money out there quickly, and I don't know what the criteria was for that and why they were under such pressure, but they were a little bit flexible and had to work with some people who were applying. So
But when I talked to them, they weren't flexible, at least on the program that I talked about. And I just couldn't design a program and meet their
Right.
criteria in less than a week and get it running. Designing it and writing the grant is one thing. Hiring the staff and getting the program going is a whole nother thing. It takes time. And it's very difficult to get people to come down and fill our jobs.
yeah,
the real-
and one of the things that they were really stressing was that they're going to give I believe it was exclusively they were going to fund evidence-based programs, and 2 of the ones that they were heavily interested in was MST, that multisystemic therapy, and functional family therapy. And there were not a lot of providers in the state, so that might be something that would be worth us
Well, I
looking into.
appreciate it if you'd email me the references, and I'll certainly look into that on Monday. I'm not going to be in the office tomorrow, but Monday I'll do that.
Okay.
I appreciate that. Capital Area, the letter of agreement, that's gone to the council. I think it's going tonight, right? It's on the council agenda for tonight. That'll be approved.
What is that?
The letter of agreement with Capital Area to use the space in the 2 parish buildings.
Yeah, but we did not go in front of the committee.
You don't have to go in front of it. It goes through the parish contracts personnel. So it's on the council agenda for tonight.
This board is supposed to approve anything before it goes on the council agenda.
It's been on your agenda for quite some time,
I
since
know,
January.
and I was told that we could not do it until we went in front of the committee. We went to the committee meeting the other night. There wasn't enough people present to have the meeting, so we've been rescheduled.
It's coming tonight, so if you want to stay and go to the meeting.
Well, I'm going to stay and go to the meeting, Susan, but that's not the point. By the ordinance, this board is supposed to approve anything before it goes to the council.
Okay. It's on January, February, March, and it's on the agenda again tonight. You can approve it. It's 4
Susan,
months.
we started in 2005 when they pulled the $88,500. Mr. Katz was at the meeting. I asked y'all to come back and tell me what the expenditures were, how much less we were going to put out, And I have not received any answers from any of the things, and it's in the agenda, and it's on the minutes. And until we can find out why they cut $88,500 out of Ascension Parish. Now, if they putting it into services, I think that is where it should be spent. But I still need to know why $88,500 was cut from the Ascension Parish mental health.
I don't know what to tell you. That happened well over a year ago.
That's exactly what I'm
Almost 2
saying.
years
They
ago,
haven't
so-
had a contract for a year, so why all of a sudden is it getting to be such a big deal? You don't know, and I don't know.
And Ascension
Well,
Parish's funds come through.
All
the state.
agreements need to be formalized, and we have an agreement with them that they use our building is not formalized, and it needs to be in writing, and it needs to be signed, and we worked a long time to get it in place. And I've been asking you repeatedly to approve it, and I don't know what you're asking for. I can't tell you how Capital Area is spending their money. I can't
Well,
tell
we-
you that.
Well, we have a state mental health board that is operated underneath the parish president. We have an Ascension Parish Mental Health Board, which is us. Yes, ma'am, we have a state mental health, Ascension Parish, 2 members is on the state mental health board. Well, you can laugh at
That's
me
the
if you want
Capital
to.
Area. That's not the State Mental Health Board. That's the Capital Area Human Services District Board. They have a
Okay.
board.
And that represents 7 parishes
Right.
in the state of Louisiana.
It represents
you-
the region, right?
All right, if you read the governor's budget, where she came down with, and that money is to be distributed between East Baton Rouge Parish by population, then Ascension Parish, and then it goes on down the line. And I'm just trying to get
Why
somebody
don't you
to come
invite
in and
Dr.
explain.
Kosofsky to come? She'd be glad to come and explain it to you. Why don't you have her come to the next board meeting and let her know that that's what you'd like her to address? She'll be glad to do that.
May I remind you all that we had that meeting with Ms. Jan. She explained that they did not receive a cut in that area.
You don't have
So
to
what-
remind me.
our
It's
question
not
is-
my issue.
No, you're saying we should meet with her, but we already have, and you were there.
Well-
the question is the $88,500 that comes from the state through Capital Area to Ascension Parish. Where is it? That's what we're asking.
Well, that's a question you have to ask Jan Kosofsky. I have no idea. That is no longer
We're
paid.
directing you to ask her.
I'm not going to ask her.
Okay.
It's your question, not my question. So we won't have approval of that again. I'd like approval again on the policy manual. I've never gotten that. I need policy approval for the new policies plus one that I added, number 307, emergency care. Have you all had a chance to review that? Do you plan to?
No, I would like
that?
to make a motion, Madam Chairman.
Okay, we'll make a motion, and then we'll have a discussion.
I motion to approve the policy manual, policy and procedure manual that came from legal. It did not have a flow chart in it. Therefore, we're adding the flow chart that we've always had, the mental health, substance abuse organizational chart of September the 5th, 2004.
We've already had this discussion. Our licensing requirement will not accept that policy, that chart. We have to have one that reflects our current operations, and
That's the motion.
that's completely obsolete. So,
That's the motion.
Well,
well, I tried to explain it to you last time. It's not a difficult concept.
may I see that? I have mine here, but, okay. The flow chart, you have the mental health and
The
substance
motion is on the floor.
It wasn't seconded.
Okay.
So you have, or does somebody want to second it?
I have questions before I second.
Vote on. You have your mental health and substance abuse board, and then you have your director. And then your people come down underneath it. This is the one that the parish committee approved about 6 months ago. And all we're asking to do is go back and take that one and put the correct names in it. It has, underneath there, you have your clinical service manager, you have your office management, and office management should be your secretaries and your clerks and what have you. We took out the organization for the United grant because we did not receive that grant. And then you have your contract workers. Why? How does that change?
Next meeting, I'll send in your packet our current organizational chart, and you can compare them and see how they differ.
Well, I've got five of them, and that's what we're trying to do, is to pass a policy and procedure manual that came through legal, and legal says use this one and this one only, I tell you. And that's what we're trying to do. No inserts, no nothing, because we don't know if any of this went back to legal or anything else. So if you would allow us to pass the one that Jeff sent me by email, we're willing to pass your policy and procedure manual. And another question is, does every employee get this, and every time it changes, we have to...
It changes every time we get a new employee.
Why does it change every
Well, we
time?
change the names on it.
Well, sure, the name's on the chart.
We have changed...
But the policy and procedure
We have changed the supervisory structure since 2004.
Why did we change the supervisor?
Because it was good management and it was a good operational decision.
And is
I
that
had
what
very good
legal
reasons to
has
do it.
approved,
No.
is my question.
I don't think legal cares one way or the other who gets supervised by whom, but I'll be glad to send it to
Well,
legal.
this is the one that they approved, right here, other than the
That's
name
easily
change.
done. I'll send it to legal. I'll send you all copies of it in your next month's packet. But licensing will not allow us to have an obsolete.
We would have an obsolete, Susan.
We don't follow it. We don't follow it. That's what I'm telling you. We don't follow the way that organizational structure is set up.
Why
The
don't
office manager's position has changed. The nurse's supervisory position has changed.
Okay, you brought up the nurse. Why would it change? Why wouldn't it be underneath a clinical service manager instead of underneath the director?
Because the nurse, as you well know, is the sister of the clinical manager, and we didn't want to have a conflict of interest, so I talked to the attorney, and he said it was fine for her to be under my direct supervision, which she is. I supervise the contract staff also.
So you have gotten a letter back from the ethics board saying that that is approved?
I don't know if he's gotten that back yet.
Well, until he gets it back, we can't approve it.
That's what we need. And may I have that?
Which is
The clipboard?
The last thing that I have to say is the community event this weekend, the bicentennial.
I haven't finished.
How about letting me finish, and then you can say whatever you'd like to say.
I'm stating the flow chart that we're talking about. You've given us 1, 2, 3, 4 others besides this one.
I'll give you one more, and then you can throw those away. How about that?
No, ma'am. How about we the boss?
I'm
How about you go
being
back?
serious. I'm being serious, Susan.
I'm being serious,
Okay.
too. We have operational decisions that are in effect and have to do with the management of the agency. I don't think you all are in a position to know who needs to report to whom. I'll be glad to tell you. But why and how we make those decisions are, part of daily
The
operations.
decision was made because you hired a sister to the director.
The decision was made because we could not find a qualified nurse who was willing to take our salary and come to our clinic. And we found an outstanding one that we recruited from a school in Baton Rouge who happened to be the sister of the clinical manager. She's outstanding. We like her. We want to
Well,
protect her position.
I'm not putting the
And I
child
really don't
down.
know what difference it makes to you who supervises the nurse. I really don't.
It makes a difference to me when I am called by legal and told that I can be fined $1,500. You can laugh, Susan. This is not a funny matter, and we have stayed up many an hour trying to work this problem out, and we're not getting anywhere because it's going to be your way or no way.
Well, yes,
Chairman.
that's what you hired me to do, was run the
Madam
agency,
Chairman.
and that's what I do.
Madam Chairman, I would like to motion that we approve the policy and procedure manual that came from legal with the September 11th, 04 organizational chart in it.
With the new names put in it. With it updated with the new
With the names,
employees.
with the update of names in it, of the
Y'all
employees.
understand what we're doing? Not really.
Can it be, if it's not updated, can it still have been approved by legal? I mean, I am in favor of only approving. If we got something from legal and legal said this is what it has to be, then I feel like we have to go with that. Can they approve something that is not correct, though, that needs to be updated?
That's why we are approving the one that legal sent. And we were advised from the Personnel Committee to do it that way.
But it's not going to be correct.
Correct.
No,
It is
we're
gonna
just
It's gonna be-
approving
it's gonna
the
be
form,
corrected.
and we want her to go back and put the
Correct.
proper
Make a
names in it.
correction.
What I'm telling you is the form is incorrect.
Correct.
We do not
She
follow
said.
that supervisory structure.
But
Well, we
legal
need
has
to
not
go-
approved the supervisory structure that you
They,
have.
as far as
that
I
you
know,
are
they did. It
following.
was in, our current structure went to them with the policies and procedures.
But there's an ethical question that a
That
clearance
came
hasn't
up
come
later.
back.
That came up later, and we're still waiting for some decision on that. So I don't know what to tell you, except if you want to wait, we can wait.
Well, how are you going to get your licenses?
Yeah. Just wait
I don't
until
know,
it comes
we
through
can
legal.
approve
We've
something
already
that is
talked to personnel. They said to do it like this. Pass that manual that came from legal with that flow chart in it. That's all I'm doing.
That's what the personnel committee.
Well, the few people that were there, but the whole board
They didn't
wasn't
have the
there,
meeting,
therefore it
did
wasn't
they?
a legal meeting.
They didn't have the meeting, so I don't know how they could make a
you
recommendation.
you took them a policy and procedure manual that night too,
I don't recall.
The thing of it is,
because Ms. Fontenot is asking us to compare the two, so that would make us another policy and procedure manual.
I don't know what copy they have. I don't remember. Mr. Savard came to my office. I don't remember what I gave him.
And why wouldn't a policy and procedure manual be good for a solid year? Why would every month?
Because policies, well, let me give you an example. The safety procedure that I just revised, number 307, didn't have anything in it about blackouts, of lights going out, and what to do with the patients, and where the boxes were, and what the procedure is. So I wrote that, sent it to the parish risk manager, who sent it to someone who's an expert in that, and got some feedback. And so we've submitted that as one more thing to add into it. And for about a year, it's going to have changes that have to be made. Eventually, it's going to be pretty well covered.
Well, that's another question I have. Okay, this is the policy and procedure manual. All your employees get this, and every time you change it, it changes. So how do they know what their job is?
It's my responsibility to see that they're updated, but I haven't distributed it because it hasn't been approved.
Well, that's what I'm saying. It's hard to work for a company that changes the
Well,
policy
we let them read the draft. We tell them it's a draft so they can understand how we operate, but it's not approved, so I don't want to bind it and give it to them.
I understand that. Yeah, and I am totally confused, so I really feel sorry for the people that work here that every month we get a new change in the policy and procedure manual. We haven't approved one. We had 6 issued to us in 2006. We're in 2007 and haven't approved one. We need to approve one to be able to get our audit from the state licenses, right?
Would be very helpful.
Well, last time, I'm going to tell you what, we didn't get one because it hadn't been passed by this board, and they held it up, and that they had to come back for us to approve that. So why can't we approve the one that Jeff says, I rewrote this to abide by the ordinance, the homeroom charter, and etc., and please do not delete all others and pass this one. So that's what we're trying to do tonight, where that we can get that, where there is no inserts of anything in here about.
But what I'm saying is that he would not have had an organizational chart from 2004 or 5 because neither Celeste nor I still have that on our computers. That's deleted. I don't know where that came from.
it came out of the policy and procedure manual that you gave us in December of 06.
We changed that structure in summer of 2005. Why don't you just let me get you the updated organizational chart and you can review it.
In this book, there's one for 10/10/06, and it also does not have the nurse underneath.
That's right, because the nurse that we had then was supervised by the clinical manager. That was a different nurse.
That's what I'm saying. So why,
So we
why, if
changed.
you violate the law, you have a right to change the policy? I mean, you
Let's
push me,
wait.
Susan.
Let's wait until we hear from the attorney before we know if anybody's violated the law. How about that? Could we please just wait on that?
Well, the lawyer said that as far as she's concerned, she didn't know. But if one of our employees turned this in, what lawyer? I got the email. I can back it up.
Jeff Diaz is the person I've been dealing with.
if one of our employees come up and say that there is some partiality or favoritism or anything going on there, then we're going to go through.
Fair
Right.
enough. Fair enough.
Fair enough. Okay. So why, and if you would have come to us like the ordinance says, before you hired anybody, and we would have known that it was a sister of an employee, we would not have approved the hiring. And that's the ordinance. The ordinance states that you come to us with the people who are to be hired, and I don't know how we hire somebody by a number if we do not know their name and know.
The parish, I discussed this with Human Resources when we hired the nurse. They approved it. The parish allows people to work in the same agency if they're related. They don't allow you to supervise your own relative, and that's the reason we changed that structure.
Susan, Jerry Salvor sat at the table and he put his finger on it and said, this is the law, we abide by the law. We are not abiding by the ordinance.
The last thing I wanted to tell you was that at the bicentennial this weekend, I believe it is, they asked each parish agency to put up a booth and to have some materials for people that explained what your agency did. And we made some preparations to do that. And then when I contacted the contractor who's running the fair, she said that we could not have a booth unless we manned it the entire time the fair was open. That's 26 hours. And there's just no way I can ask staff to be there 26 hours, so we're not going to have a booth at the fair. I was really disappointed, though. We had our display and some brochures and things we wanted to put out. So if you see some people are going to go there a little bit, but she flat told me no. So
Understand.
okay. Is there anything else? Any other questions that you have? Thank you.
Anybody have any questions?
Can I make a motion that we have a working board meeting to discuss some of these issues further and talk about the format of our...
Yes, ma'am, we can call a special meeting and we can get together, and all I have to do is give a 3-day notice and turn it into the papers where anybody's entitled to know that we're having one.
Well,
we'll take care of that, okay? Approval of the DA's invoice.
I make a motion
Celeste,
that
was
we
our
approve.
invoice in our package?
Yes, ma'am.
Yes.
Yeah, it is.
It's not in mine.
I don't have one.
It's right here.
One right here.
You want to look at it? You need to look at it.
Yeah, I don't, it's not in my package. Oh. Okay, and why is it $4,000 and something dollars? Do we know why it is up?
Actually, there's months to where there's 3 pay periods instead of 2 pay periods.
Uh-huh.
So that, and we did have one last month, so I'm sure that's what we're being billed for.
Okay, because the 2,900 and something is correct, but then the rest of it?
It was probably because the employee got paid biweekly, and there was 3 pay periods within that month instead of 2 like usual.
Okay. Understand.
I make a motion that we
If you still
pay the
sorry.
district attorney's bill.
I second.
Vote. Ms. Latif? It passes. Okay. Budget report, Ms. Celeste.
Okay. I have a few other things also to discuss besides the budget, but I did want to let everyone know that myself and Dr. Mittendorf and Ms. Baptiste did meet on the second Wednesday of the month, which was last Wednesday, to discuss our February reports. Also, Ms. Gautreaux, she was out of town, so she wasn't able to be present, but I do have your 2006 reports ready for you if you don't mind coming by the office or something next week, because it's a big old packet instead of myself putting it in the mail.
Oh, sure.
I just wanted to know if anybody had any questions or anything about the February report that was given last month. And then what you have in your packets today is the March activity reports, March budget. And we'll be discussing that next month on the second Wednesday. So did anyone have any budget questions at this time?
We're looking at this paper that Ms. Baptiste brought me. I see a bunch of those little exclamation marks out at the sides of them.
Yeah, we had talked about, I'm not sure exactly which one.
Well, on the first,
Is there a category that you're talking about, Ms. Italia?
on page 1, I see health.
I don't have my budget with me.
Oh,
I'm sorry,
okay,
I didn't bring. All I have is the one that I'm giving to you tonight. Is that what you're talking about, the March report or the February report?
Actually, it's got January 1st through February the 28th on the one I'm looking at, so I may be
Okay,
way
that's-
off a base.
Yeah, that's the one actually we met with Ms. Italia on. I'm sorry, Ms. Baptiste on
Yeah.
Wednesday. And there is some
See, like telephone.
adjustments that finance is making for us in order to correct those. When we had actually made the budget, the telephone was supposed to come out of just the mental health budget, but they've taken it out of mental health and substance abuse, where we actually didn't budget any money in substance abuse, and they're going to reverse that for us and
Okay.
take it out the mental health instead of the substance
And then
abuse.
then it has furniture. 99999 over there. I don't know.
Which
It
cost
has
account is that?
furniture, office machines, and equipment. It's 4035. Professional
Are
services.
you actually maybe looking at 4032 instead of 4035?
40 what? 4024, 4035, right. 4035. What did I say?
You said 4035, but that's not. I think you're looking at the one above it, which is 4032. 4032 was that encumbered amount for that vehicle expense, which if you look on the report that I gave you tonight, that has been corrected.
We don't have a 4032, babe. We're not on the same page. I don't know.
You said you're looking at the expenditure report.
It says page 2, 3rd and the 23rd of 07.
It's page 1. It's on page 1. It's on page 1 that you're talking about.
What paper that says page?
Top right-hand corner actually says page 27.
Page 1.
If you look here.
Okay, we all got different paperwork. That's okay. We will get it straight and come back.
You want to
because-
maybe talk about that at our next?
Yeah, we will, because she does have
So
it on
we'll be on
page
the
1,
same
and I've got
page?
it on page... that's okay. That's good. I figured I had the wrong paperwork. Yes, ma'am, we will, and I don't promise to be in town either, because if the kids say, let's go, I'm always gone.
But it's also on page 2.
Okay. We'll discuss that, and we're going to go through last year's budget and see how we fell in line and what we approved for this year, and kind of get an idea from now on as to where we're going. And if we need another counselor, if our counselors are overworked or something is going on, and I always thought Celeste was seeing patients. I mean, not Celeste. Stacy was seeing patients. I didn't realize that she was just overseeing the counselors, and I would like to discuss that with Miss Susan, too. Okay.
I did have some other things, Ms. Atay.
You have anything else that you would like to?
Yes. I did want to let y'all know that we received our renewal packet in for our malpractice insurance at the end of February, and at the beginning of March, I did submit that renewal to Robert's. In the submittal, we also, at this time, we do have a $15,000 deductible. I did ask for some increases in the deductible in order to bring down the premium. Last week I spoke with him and he hadn't received any quotes yet. The policy expires May 23rd, so I'll keep y'all up to date as to what's going on, but we have not received any quotes back yet this year.
And on that policy, we had the OCS contract where we were going to carry some extra coverage to cover seeing those patients, and it cost us $4,000 and something extra for that. and we
was-
did not get a contract with them, are we going to still carry that, or are we going to drop that?
Actually, it was $1.3 million, $1 million, and the reason why the OCS wasn't the only reason why we increased that policy. There is some other insurance companies that we do contract, as a provider with, that they also require that type of coverage. So
Okay,
it wasn't-
because in my
OCS
minutes,
was
it
not-
just states OCS, you see.
OCS was not the only reason
But
why.
but it is not the
And
only reason.
as we're starting contracting with more insurance companies, we do see it coming up more and more that they require that $1.3 million. So I would think it would be best that we stay with that.
Okay. And when we contract out, like on grants where we hire the counselors that go to Donaldsonville, they're insured under this policy also, right?
I'm not quite sure. I think that's something we would need to check on.
Okay.
I do have to list the employees and send
Because
them in.
I'm talking about 1 to August and those people on that thing.
I'm sure.
That's a
I'm
grant?
not quite sure if they I would have to check on that and let you
Okay.
know.
All right. Thank you.
I do have 2 other things.
Go right ahead.
Okay. I did want to let y'all know also, as far as maintenance goes, the last time, last year actually, when they came to inspect our fire alarm in Donaldsonville, they stated that the system was very outdated and recommended that it be replaced, the fire alarm. So they're in the process now of replacing that, so we have that going on this week. And the last thing I had was, last meeting, y'all had asked me for different copies of evaluations that were done in the past. So what I have for you tonight in your packet is the evaluation that the parish currently uses, and you have to reflect back to the job description in order to do that evaluation. So what I did was I did also include a copy of the director's job description. So you do have that, what
Got
you
it.
were asking for, Renda,
Thank you.
in your packet also. It's along with those evaluations.
Right here.
So it's that evaluation that the parish currently uses, and the other evaluation is one that the board had made up at one time and they use. So you have 2 in your packet along with that job description. And that was all I had.
That's it? Thank you, Donna. Okay, anybody else with any questions on that, the budget? I know we're pretty well staying within the budget, and I know some funds will be transferred around, but I was trying to going back and checking last year's full account with what we have budgeted this year to see where we underspend or overspend, where we can make our budget more accurate. And that's the only reason for that study. Okay, old business. Mr. Butler had wanted to discuss the building in Donaldsonville, but he's not here tonight. Anybody else with anything under old business? Anybody with anything under new business?
New business. I have would like to say to Ms. Celeste, on our minutes of our meetings, we were told that we need to document every word of our minutes because they're legal. They're used for legal purposes. And also, I would like to motion that the parish would begin to pay the bills for the coroner's fee.
Would anyone like to second that motion?
Can you explain that a little bit further? Can you say more about that?
Well, we have discussed it time and time and time again for over a year. And the parish felt that they thought they were paying it already.
We actually have always paid. We hadn't stopped paying it, Ms. Baptiste. The coroner's fees, the invoices, it's still being paid.
Yeah, we know.
The parish is paying it.
It's coming out of the mental health fund.
Okay, well, that's why they told us when we talked to them. They told us.
Well, that's what you didn't make clear to Ms.
Yes.
I didn't realize So
Ms.
what
Renda,
was your
is
motion, Ms.?
Jerry Sawar suggested that we just make a motion and send it back to the parish and let the parish handle it.
So
Since
what you're stating is a motion for it to come out of the general fund and not the mental
Yes.
health fund is your motion?
Yes, that's my motion. Would you like me to restate that?
I got it, thank you.
Now it's clear.
And Jerry Sawar did that, but we really did not get to discuss this with the proper board and come back with it. But since no other parish has a mental health department like we have, it is paid for through the general fund. It is not paid for out of ours. In some kind of way it got put, but it's in our ordinance, and so till we get it cleared out, I don't know if we can go this route.
It does
Ms. Baptiste.
state in the ordinance that the corner fees would be paid out of the mental health
That's what I said. It got
So
put in
I
the
don't-
ordinance, but it got put in there because of
So
parish
without
president.
changing the ordinance, I guess you would have to get approval from the council that they
That's
would go ahead
exactly right.
and
That's-
pay those fees before
That's
we
why-
can stop paying them.
That's why I think that we should put the 4 things back on the agenda to go in front of that committee again that we put on there last time. If you don't mind handling that for me and find out when they're meeting. We will try it once again.
I did want to mention too, I know earlier I was talking about the capital area agreement. That was the agreement that it was recommended that that went to the finance committee instead of the personnel committee. Therefore, it did go to the finance committee, and the finance committee approved it. Automatically, when finance committee approves, it goes on the council agenda. Therefore, that's the reason for it being on there tonight.
But who is going to do the research on the questions that we want answered about?
I think the problem is they don't know the questions that you want answered.
And that's why I wanted to go in front of the personnel committee to get them to turn it over to the parish government to do the research, because it really has nothing to do with the parish mental health board.
Right.
It has to do with the state mental health board. And when this decision was made, it was made by the parish president, Mr. Roy Katz, and Miss Susan, and it had nothing to do with this board's participation. We were just given the facts after it had been decided. And if I read the ordinance correctly, it says the board has the right to decide who is in the building and who is not a resident of the mental health building. And it's not, I want the state to stay there. That's not my problem. My problem is for the parish government to find out and come back to us with the state mental health board and us work together. Okay.
So
Madam
who do we
Chairman.
need to request look into that? Is it the
We have to go back-
finance or
It
personnel?
actually has went to finance committee already and was approved by finance committee. But, I mean,
But who represented us there?
no one did. Actually, no one represented the board there. Sandra, who deals with contracts, was there to present it to the finance committee.
Right, but if they don't have our facts, how can they just, because it's their job to find the facts, not our job to find the facts.
Can you just let us know when the next finance committee is?
It's on
and we
tonight's
can-
agenda for the,
I understand that, and I understand for
So
this
it's not
time
gonna
it's
go
too late.
backwards.
But if we can find out when the next finance,
And just
Committee
go sit down
agenda
and
is-
talk to them. Okay.
Okay, Madam Chairman, I'd just like to make the statement. I'm asking the board members to please read all your information. I attend some meetings that y'all don't, and it appears that every motion that I make or something, it's like I'm doing something that's not right or that we don't know it, and it's because you don't read the information. We've talked to people on committees, and they instruct us to do these things and to make these motions, and that is why I do what I do.
No, you
But-
did well, but it would help just to elaborate a little bit on that last
To
one.
even read, if you would just read your information.
But
Well,
that
I
wasn't
can read
on
it.
there that Jerry told us that.
But you could elaborate just a little bit about the motion, which I second. But just,
So therefore, we need to meet as a committee sometime,
That's what we agreed
just
to
us
do.
and update people on things, right?
Correct.
But I thought.
because I was
if-
not
if-
aware of that.
Yeah, I thought if you made a motion or something, you knew exactly what you were talking about, and you didn't have to be questioned.
Yeah, well,
Okay.
Thank
you.
Okay, thank you. Would somebody like to make a motion to adjourn?
That motion we adjourn.
I second.
Any objections? If not, meeting is adjourned.